Welcome, everyone. Today we are going to talk about growth and development. This is the start of my series on growth and development. We will begin with infants and work our way through all the developmental stages, talking about growth, motor skills, both fine and gross motor skills, psychosocial development, language, all of that good stuff you need to know for the NCLEX. Let's start with growth in infancy. Very, very rapid growth occurs. A birth weight of an infant should double by the time they are 6 months old and triple by the time they are 12 months old. Infants also have those nice fontanelles, both anterior and posterior. You can see these little triangles over in the photos. You need to know when those close. The posterior will close first between 1 and 2 months of age, and the anterior fontanelle will close between 9 and 18 months of age. We want those to be nice, soft, and flat. You should always assess fontanelles when you have a patient that is under 18 months of age. Next, for development, we'll start with gross motor skills that are developed in infancy. Here are four of the major ones you'll need to know for the NCLEX. Child should be able to sit up without support between 6 and 8 months of age, roll over around 6 months of age, stand up without support between 10 and 12 months of age, and they should take their first steps around 12 months of age. Milestones like these are ones that parents get really caught up around. So, as a pediatric nurse, you need to know when about the normals are so you can help reassure parents and give them advice. Oftentimes, if we're not meeting these milestones, though, physical therapy or occupational therapy will be the experts that we get involved to help evaluate the infant. Next thing to go over, instead of gross motor, we'll talk about fine motor skills. These are the four biggies for the NCLEX. We want to see the development of a palmar grasp around 6 months of age. That's in this first photo on the left, where an object is in the palm of the infant and their fingers curl around it to hold it. The pincer grasp is a tad more complicated and should be accomplished by 9 months of age. That is when you can see in the right photo, the thumb and index finger can be used to pinch or hold on to an object. That is the pincer grasp. The child should also be able to bring objects up to their mouth, like their toys or maybe a spoon or fistful of food, by 4 months of age. And they should be able to transfer objects from hand to hand between 6 and 8 months of age. Another big developmental thing is language. We have tons of language development going on in infancy. Their first words should be said around 12 months, but they should be able to understand what no means by 11 months. They should also be able to follow some super simple directions around this 12-month milestone. So most of those big language milestones occur at the very end of infancy. The beginning of infancy, of course, they're not going to be doing much as far as language goes that we can see. All the development is what's going on inside of their heads. There's a lot of growth and just crazy cool development stuff that's happening, but we start to see it towards the end of infancy. Okay, next up is psychosocial development. I know that not everybody gets very excited about this. You don't like Erikson and Piaget, but the NCLEX actually has a pretty strong focus on this growth and development. So you really need to know the stages and some basic terminology to be able to ace your NCLEX. Erikson's stage for infancy is described as trust versus mistrust. So this will be what is occurring between birth and 12 months of age. The infant is going to be very focused on their mom and father as caregivers and their needs being met. So, whenever those basic needs are met, they feel trust. If they're left crying and crying in a wet or dirty diaper for hours on end, they would develop mistrust because their needs are not being met. As far as Piaget's stages of cognitive development go, in infancy we are in the sensory motor stage. So Piaget describes that in this stage, children gain knowledge through their senses and motor movements. So they're taking it all in, they're touching everything, putting their mouth on it, and they're gathering information about the world around them. A few psychosocial development milestones that you need to understand terminology for. Kids should have a social smile by 6 to 8 weeks. So, this does not mean that they understand you, they recognize your voice, they just hear comforting sounds and should have that social smile. They should kind of smile in response to cooing and talking to them. Object permanence should occur around 9 months. That term is used to describe a child's ability to know that an object continues to exist even though it can no longer be seen or heard. This is where peekaboo comes from. They know your face is behind your hands even though they can no longer see it because your hand is covering it up. So a child should have that sense of object permanence by 9 months. This would also follow that if you hide a ball behind the couch, they should know that that ball continues to exist and go look for it. Stranger anxiety should also develop around 9 months. I know you all understand that one. People who aren't mom, dad, close family, they should start to be wary of them. Younger than that, a 4 or 5 month old, you can just pass them around to anybody. They don't really care who's holding them. Around 9 months of age is when kids start to develop that anxiety with strangers. Last thing I want to quickly touch on before we get into our NCLEX questions is therapeutic communication. Of course, we need to know how to communicate with all of our patients, and this can be especially difficult with infants because they're not doing a lot as far as communicating with you. Really, what you want to know is to just speak in a soft voice and do everything you can to promote that trusting relationship. For example, warm your hands up before you touch the baby so that you don't touch them with cold hands and startle them. Take care of their needs, change their diapers promptly, just attend to them, always speak with them, don't ignore them. You also want to always involve caregivers if one is present. Caregivers are going to be doing most of the communicating as far as verbal communication, so you want to explain everything you're doing to them. Have them hold the infant to promote that trusting relationship. Parents are often your best team member with an infant because they know how to keep their child happy and calm. And trust me, it's very hard to auscultate lung or heart sounds when a baby is screaming. So, a parent will be your best friend when they're a participatory member of the team. That does it for all of my points about infant development. Let's wrap it up with an NCLEX question to test your knowledge. You are assessing a 9-month-old infant in the clinic. Which of the following findings requires follow up? Select all that apply. A. Infant sits up with the help of mom. B. Infant is rolling over from front to back. C. Infant holds a cube in the palm of his hand and closes his fingers around it. D. Infant cannot bring toys to his mouth. Correct answers here were A and D. A was correct because that finding does require follow up at 7 months of age. An infant requiring the help of his mother to sit up at 9 months old is not normal. At around 7 months, the infant should be able to sit up without any support. So, without that growth motor skill achievement, the infant requires some follow up, probably further evaluation by physical therapy. D was also correct. The infant not bringing toys to his mouth, the inability to do that, is not normal at 9 months old. That milestone should be developed by 4 months of age. It's an important way for that infant to explore the world around them, especially with Piaget's sensory motor cognitive stage of development. So the nurse should follow up on that finding, chat with mom about if this is normal behavior, if he does this at home, and consult her physical therapy teammates. B and C were both incorrect answers. The answer B, infant rolling over from front to back, that's a normal finding. That gross motor skill should be developed by 6 months of age. So for a 9-month old, that would be appropriate and no follow up would be indicated. C was also incorrect. The infant holding a cube in the palm of his hands and closing his fingers around it describes a palmar grasp. That gross motor skill should be developed by 6 months of age. So, again, for a 9-month-old, that is an appropriate developmental finding, not requiring follow up. All right, that does it for growth and development in the infant stages. Please continue this lecture series on. The next stage will be toddlers from 1 to 3 years of age. Again, I know this is not super interesting and fun for most people, but the NCLEX has a lot of questions on growth and development. I remember being thrown by them myself. So take the time to go through those Erikson and Piaget stages, know your milestones, and you won't be tripped up by them. Thanks for listening. Of course, let us know if you have any questions, and best of luck studying.